Miracle Foundation is addressing primarily for the childcare institutions and with our CCI partners is really building their muscle, building their capacity in this methodology of case management to ensure that children are safely and permanently reintegrated with their families.
Today we have with us Richa Tyagi, Director of Strategy and Technical Expertise at Miracle Foundation India. She is responsible for steering strategic evolution, focus, planning, initiatives of the organization, both for new programs as well as the ongoing programs. With a stint of 7 years with the organization, in the past, Richa has led Miracle India's partnership program with UNICEF and State Government in 4 states on family-based alternative care. She has been instrumental in conceptualizing and laying the foundation of various programs at the foundation. An M.Phil in Planning and Development from IIT Mumbai and an Atlas Corps Fellow from the Grameen Foundation in Washington, D.C., Richa has been in the development sector for the past 16 years and has extensive research experience. She has also been actively involved in carrying out research projects, due diligence, needs assessments, evaluation, and impact assessments with the Federation of Indian Chambers of Commerce and Industry, NIIT Foundation, Delhi School of Social Work, and others. She has worked as visiting faculty with business schools in Delhi NCR and as a master trainer with the Indian Institute of Corporate Affairs in the area of corporate social responsibility. It is an absolute pleasure to have you here with us, Richa.
Thank you.
So I want to begin with a brief introduction from you about the key issues within childcare institutions in India today, specifically, that Miracle Foundation is tackling.
All right. So today, what Miracle Foundation is addressing primarily for the childcare institutions and with our CCI partners is really building their muscle, building their capacity in this methodology of case management to ensure that children are safely and permanently reintegrated with their families or with family-based alternative care options. And in this process of case management, very important tools that they get trained in is the Thrive Scale, the Thrive Scale methodology of Miracle Foundation, which is really examining the 5 well-being domains. And I'm sure you will be talking more about it. But this is the primary thing which we are addressing today. Other than that, until the children get reintegrated with families and until the time they are there in the childcare institutions, it is also important for the CCIs to really take care of them and provide them with that quality care. So it is very important to look after all those areas. And that is where the methodology of CCI Thrive Scale that we have, where we are really looking at the rights of the child, those primary rights of the child, which are responsible for the holistic development. And that is where looking after the health, education, child protection, child safeguarding, child participation. So also looking at, like, within the CCI, the children are taken care of until they are in the process of getting reintegrated with their families.
I wanted to ask you first, when training on-ground professionals to interact with children in such a sensitive space, what do you think are some of the key and vital aspects that we need to focus on?
Yeah. So let me also begin with this question with a remark which I noticed last year in one of the juvenile justice consultations. And these juvenile justice consultations are steered by the juvenile justice committees of the Supreme Court and the High Courts. And in that discussion, one of the things that was pointed out was how important, how increasingly it is important for the juvenile justice system in India to move from head to heart. So basically in Miracle Foundation, when we are in our work, which is like capacity building of the social workforce and child protection functionaries is a very, very integral aspect of our work. And when it comes to the point of they engaging with the children, the sensitivity with which they need to engage with the children. There are certain areas which are very important on which we work with them. Number one is really about the safety, the child safeguarding policy, and building their capacity in that sphere of looking at all those dimensions of awareness, prevention, reporting, and responding when it comes to child protection and child safeguarding. The other important area is, which we always say, listen. Listen to the child, listen to the families, listen with your, not only with your ears, but with your eyes, with your heart, listen. So it's really about listening to them. It's really about listening to all those voices of the children and the families in this process. So if it is really about, if you look at the sphere of case management, where we are building capacity on all these assessments and how they have to prepare children and families and, to help them reintegrate, it is very, very central. It is very integral to listen to the voices of children and families. After all, it is about their life. It is about their needs and concerns, which we are looking at. So the voices in decision-making, their participation is so very much critical. So these are important elements that we are touching upon when we are helping them build their capacity in this sphere. It is always emphasized right from the, even in the, if you look at the whole purview of the Juvenile Justice Act, when children actually come into the system and into the CCI, and that's where the Supreme Court these days has been emphasizing that individual care plans and the social investigation for children, the individual care plans really have to be prepared in consultation and discussion with children. So I think this element is something which is really, we all believe in it, we all theoretically know about it, but I think we also have to learn as organizations, as professionals in this sphere, to deepen our really this point of child participation. So that is what Miracle is striving to, to really make it really that participation, which is something which is their voice. They're making it, they're doing it. So that's why we are also doing child-led webinars. And
so Miracle Foundation focuses on utilizing data and technology, right, to create sustainable change in the world of childcare. Now, how does data play a very crucial role, and how has it helped you in the past in bringing about change, you as a Miracle Foundation, of course?
Yes, so that is where the methodology that we have evolved, as I just mentioned about Thrive Scale, it's really a data-driven tool that helps us to systematically measure and look at how we can bring about those improvements in the well-being of children, and how has it helped us. So if I were to just give you an example, and I think that will give you a good insight, over these, ever since you can go back to April 2020, March 2020, when, before the onset of the COVID, or it was really, I'm just giving you one piece from one of our programs, which we call the base model program. And there, it was the children who went home, like at that point of time, there were around 350 children. And then with COVID, children were sent back home all of a sudden. And all this process happened where they were in the process of case management at different stages of assessments, planning, preparation. And then all of a sudden they were sent back home. And this was a time for us which was very challenging, because it was not possible to visit the CCIs. It was not possible for the social workers, case workers to visit the families and to carry out this process. So that is where, when we evolved this approach of expedited case management, where all these processes of systematically doing these assessments, planning, preparations were carried out remotely. And this is where, and using these tools, how the Thrive Scale really helps us, because we then try to look at, measure the whole progress and the kind of risks that are involved, what are the strengths, but then we measure it on across a rating of, we look at what is the situation. Is it really a very, very critical in crisis situation that needs immediate attention? Or is it Is it something which is vulnerable, that needs attention, but not immediately? Or is it something which is, safe, and it's something where it's not really any attention is needed? So there are different categories where we try to rate. And then based on this intervention, this process that we carried out, we were able to look at reintegrate 60% of these children safely and permanently with their families. And with rest of them, the process is on right now. So this is how, because this process of assessment, the tools that we are using, there is a structure to it, there is a systematic process to it, how every month, every quarter, those assessments have to be done. And then one has to look at what is the status, what are the scores, what is it indicating in terms of the red flags, what are those risks that have to be mitigated, without which we cannot move ahead. And then what is it, what kind of interventions, what kind of support is required across those 5 well-being domains? So as I mentioned to you, this Thrive Scale methodology, particularly when we are looking at the families and children, we look at the spheres of the health, education. Health includes mental health, education, you have family and social relationships, household economy, living conditions. So these are the spheres where we are trying to really examine the situation, the risks involved, what are those strengths, and what are those needs, and if that is the case, then what kind of support is required. So this way, a lot of data gets generated. This data is then, we use form assembly where we collect this data. It helps, it goes into our MIS, which we have, like, it's called case management tracker, and then this tracker actually tracks every child's progress. And this is the data, based on which I'm sharing with you that how these many children were reintegrated in this process. So this is how it is helping us at every step, which is like a scientific way of looking at it. And it is not left to the subjective thinking of people involved in the process.
Right, I agree. I mean, it does bring a sense of objectivity to very subjective people and a very subjective field, which is childcare. Now that we have spoken a lot about Thrive Scale methodology, I think it'd be good to just start with that. So could you explain what is a Thrive Scale methodology? How does it work? And how does it focus on a child's well-being, and why that is relevant? I mean, we know why that is relevant, but if you could just elaborate on that.
Okay, so basically Thrive Scale tool, as I said, it's a data-driven tool, which is really helping us to look at the I would say, let's say, put that in 3 spheres. Number one is particularly when we are looking at the possibility of reintegration of a child from a CCI back into the family. It could be a biological family, or it may be like, where we are looking at other options, alternative care options like adoption, foster care, or where it is not possible to reintegrate with biological family. So in this process, it is very important. So this tool is helping us to look at what are those needs. What are those needs of the child and the family? And then what are those concerns? What are those areas, risks, which we call red flags, which have to be addressed? And so based on that, we'll be able to know what kind of support is required by this family and this child. So when the child is going back to that family, what kind of preparation is needed, what support the family will require in those well-being domains, as I just mentioned. So that gives us a good picture while we are preparing the child to get into this, get connected, go back to the family. So really looking at, this area. The second sphere is once the child is reintegrated. So now like, based where we are doing these assessments, and we are able, based on over a period of time, to actually look at now, the child and the family are ready to be reintegrated. Then what is the status once the child is reintegrated in terms of the follow-up? So, it's not a mechanical thing that you've sent the child home and everything is now wonderful. Now you have to do that follow-up and monitoring, and which is, as per the Juvenile Justice Act also. And we also believe that at least over a period of 2 years, the situation of the child in the family has to be monitored to ensure that the risk areas are under control, that, situation is not worsening, perhaps what kind of linkages the family requires in terms of support, be it the livelihood-related support, is it health-related support, or different kinds of support schemes, social protection schemes which are there. Or that kind of follow-up. So the tool helps us to do that kind of follow-up. The third sphere is that there is a scenario that it is not always about children getting reintegrated from CCIs into families. There are also situations in the community where children are vulnerable, families are vulnerable, and they are at risk. And if the risk situation or the vulnerable situation is not addressed, then there is a likelihood that there will be a breakdown where children might get abandoned, children might get into child labor, into trafficking, they get separated from the family. So this tool is really helping us to do those assessments in the community. And this is what we call the preventive side of our work. Like, how do you prevent children from getting separated from families and then ending up into the child protection system? It could be like going into the CCI. So that is the third sphere where this Thrive scale is really helping us. And as I mentioned, that there are 5 well-being domains where and then of course, since it is a tool, you can imagine that across these 5 well-being domains, there are a certain set of milestones that have to be looked into and which are rated on this scale of 1 to 4. So across these milestones, we rate, and then we give the utmost priority wherever the situation is critical. Where the child is in crisis. So those areas, those are really given the utmost priority. And so these are the 5 well-being domains, and we are very particularly looking at the red flags across all domains. So when I say red flags, for example, if it is about education, a red flag would be that the child is not in school. This is a risk situation, needs to be addressed. Or for example, if it is health, the red flag could be that there is substance abuse, there is some severe mental health related ailment in the family. Those things like that. If it is about family and social relationships, it could be about if there is some history of abuse in the family, or if there is if there is a threat of the child. Once the child is reintegrated, there is a risk of child getting into child marriage. So these are certain risk areas, which are very signals, like, alert signals, which have to be immediately addressed first. So this way, this is how the tool really provides that kind of support to the social workers, to the child protection functionaries who are actually working with children.
So just a question that came to me right now while you were speaking is what happens once you've decided what the risk factor is, like it's 3, 4, whatever it is. What is the procedure in place? Is there one in place about what happens right after it, or do you go like by case basis?
So basically, if it is every child, so every case is monitored that way, and if there are if there are red flags, that is the first priority to address. So what is the procedure in place in that, which is what kind of support intervention, or what is the immediate intervention which is required? So when the social worker visits, conducts these assessments, and finds that this is the red flag area, because you have the case management tracker, the MIS system, which flags, like in case of every child, what is that red flag. So in those cases, first of all, one has to look at what are the most critical things first. Like, suppose if there is a physical abuse, it's a sexual abuse case scenario in a family, then that's the immediate thing that has to be addressed. And then in that case, we have to then look at, so it is not something where Miracle Foundation or Miracle Foundation supported CCI is providing all the answers. We don't have. Here is the time when we are also engaging with the community support system. And one has to look at if it is about mental health related issues, then if it is through the district mental health services, or what are the supports areas available around. If it is about living conditions, household economy, then what kind of social protection schemes and entitlements one can link to. If it is something very, very critical, immediate, like for example, the terrace, the roof is like falling, so maybe some immediate support is required, which is like you can't wait for. So that is where perhaps we, help the CCI teams to look at it wherever they are, to provide that kind of support. But direct support is something which is, we are really mindful of engaging with the system, the community support system, which is like, could be about the child protection committees existing there, the Anganwadis, the Ashas, the Panchayat, the PRIs, the Panchayati Raj institutions, or the local governance system, which is existent there. And of course, the district child protection unit also comes into picture. So the point is, when it comes to support interventions, that is where it is about the community support mechanism, the community-led child protection mechanism that we say. And that is also an important area where we guide the teams of the staff of CCI as well as the people in the community to engage with the system. So that is the approach.
What you just spoke about, community support systems. While you're partnering with these support systems, or even with like state governments, things become a little large scale, right? Many people are involved, different departments, there's a bureaucracy involved. What are some of the possibilities and challenges that you have faced in this partnership, and how have you tackled them?
Our cardinal principle is to work with the system. Miracle Foundation, in terms of some of our anchors, which we call as anchors in our strategy, is really not to duplicate and really work with the system. But the point is, in this sphere of work, what they say is that there are 4 pillars in this work of family strengthening and family-based alternative care. So those 4 pillars are really about the political will from the government and the state or the district or the government counterparts. So that really matters. So, and then the second thing is about the know-how, the capacity building, know-how, as well as funding. So these are the 4 pillars in any system when you have to work towards something which is child-centric and in the best interest of the children. So in case of Miracle, we always endeavor to work with the system at the district level, at the state level, at the central level. So our engagement is like, we try to look at through UNICEF and with the government, state governments. So that has always been the approach. We believe in it. Of course, it has its challenges. Because the point is a very, very stark challenge is that the government, especially the senior officials in the ministries or the state governments, tend to get transferred. So the philosophy or their approach varies. Like somebody who was working with us, supporting us, and they believe in this particular thing, that is the kind of goals they have created at their state and district level. But when someone else comes over there, then there is a shift in the approach. So these are all, this really becomes very challenging. You have to then start from the scratch in engaging with the new team members. So those are the things. There are bureaucratic procedures which cause delay in conducting programs and conducting those things. So that way system has its own challenge. But, even with that, we believe that it is important to work with those people who are at the helm of affairs and supposed to be doing this, than to duplicate their work. Can't really replace the whole government machinery in the country. So, yeah.
And as you said, working with the system. So you're also, the foundation is also working on codifying UN rights for child within India, right? How has that process been like? Like, what are some of the challenges you've faced in bringing those global rights to local areas and institutions?
So that was always the approach towards developing the Thrive Scale methodology. So basically, if you look at the work of Miracle Foundation over these 20 years now, our first tool that we developed was really about the CCI Thrive Scale, where we were looking at codifying the UN rights of the child, really looking at the UN Convention on Rights of the Child, and where we picked up 12 rights of the child and codified them on standards of care and protection, which actually got developed into a CCI Thrive Scale. And further, because that work was really about how do we build capacity of the CCIs to create a family-like environment within their institution. As our strategy evolved over a period of time, where we now increasingly believe that children, it is important that children should be prevented from coming into the childcare institutions in the first place. It is important for children to grow up in a family where they belong, the communities where they belong. And if at all they are coming into the child care institution, and if there is a family back home and for some reason they are here, then one should work towards strengthening that family and perhaps then look at this process of reintegrating them. So therefore, when our strategy evolved, we really looked at the thing of home Thrive Scale. We called it home Thrive Scale, but then later on we've changed it and now we call it Thrive Scale, which was really about, the Thrive Scale, which was looking at fulfilling and providing for the rights of children right where they are, that is in those communities. And that is where the Thrive Scale with 5 well-being domains came into existence. And if we look at this particular Thrive Scale, it is actually covering 24 rights of the child from the UN Convention on the Rights of the Child. So this process where we actually codified rights of the child and developed these guidelines and standards was something which was, where we examined the global as well as the national laws, guidelines, and everything was studied. In terms of, the challenges, basically, not really challenge, I think that's the process, because, when we engaged with our stakeholders, whether it is CCI partners, whether it is government, whether it is other NGO partners, and people who the entire social workforce, it is like this is really a mission where we were looking at how can we make these tools and this knowledge and this expertise available to them. So that is what it is. But it takes time, because it's like Miracle Foundation always believed that we are a capacity building organization. We are not a funding agency. I mean, we never portrayed ourselves like that. But perhaps it takes time where people need to see that, when we, as to what is it, like, because the evidence base has to be there. So that is through the work that we have done over the years with our CCI partners, with the governments, and with the local NGO partners, which is like an evidence base for organizations to see. But it takes time, for people to adopt this, learn this, apply this. But once they see the benefit of it, they're able to they would like to use this systematic approach in taking care of the children in their communities and families.
I think definitely time and persistence are key to any long-term project. All right. With that, we bring our interview to a close. Thank you so much for being here, Richa. It was a fascinating conversation with you, and I'm feeling enlightened. So thank you so much for being part of Impact Talks.
Thank you so much. Thank you so much for showing your interest to know about our work and bringing forth these questions.